Good morning, everyone. It's such an honor and pleasure for me to be able to be the moderator of a panel joined by four wonderful speakers today. And we have Shilpa from the Zubin Foundation, we have Faye from Neighbourhood Action, Anju from the Baptist Oikun ICCMW, and Anthony from the Health in Action. Okay, may I ask you guys to welcome and Okay, so today's panel is on what is the status of mental health in Hong Kong among ethnic minorities. As you learned from Shalini, Danish, and our wonderful team from Hong Kong U, a lot of things, information that we gather from the top. Now we are from the bottom up to see what happened in the community about mental health. Okay, so I was involved with the advisory committee for the Zubin Foundation. It's my honor. Since 2020, I actually started working on this topic with my former PhD student 10 years ago. And during that time, we knew very little about mental health or development among ethnic minorities. And now today we have joined by so many advocates on this topic, so this is actually really wonderful. So we, as an advisory committee, we work together and discuss a lot of issues, especially shared by Shalini. There are a lot of complexities while we were developing the protocol, dealing with crisis situations, even though we exclude people with suicidal ideation during the treatment, but there are crises that we have to deal with, and who and when to refer the suicidal cases to the ICCMW or other community partners. So today we are going to talk about their wonderful work and share with all of you and see if you have any comments or questions for these four speakers. So may I please invite each one of you to speak for about 2 minutes. Your name, your job, and your duties of helping ethnic minorities in Hong Kong. And then after that, we will come to the discussion, right? Shilpa.
Hi, thanks, Paul. And good morning, everyone. I'm Shilpa Patwardhan. I'm the lead counselor at the Ethnic Minority Wellbeing Center of the Zubin Foundation. So I'm here to give the direct counseling to the clients as well. We are a team of 7 counselors at the moment, including myself. So 3 of us are in-house counselors, while we have 4 consultants as well. So I do provide direct counseling as well as I supervise the other counselors in my team. And I work with the project director in continuously improvising various protocols, treatment protocols, what we have. Thank you. Thank you.
Faye?
Hi, everyone. I'm Faye from NAC, one of the NGO in Hong Kong. And I am here because I'm responsible for supervising a team of an outreaching team, which is serving the ethnic minorities in Hong Kong. So I have my teammate in a team about 12 staff, but only 4 social workers in my team in supporting, services to the ethnic minorities. So our team, there's an outreaching team. So what I'm doing is just like we are a hunter. So we are hunting for in a community for those non-Chinese people in Hong Kong who are in need of any kind of services, no matter physical health or mental health, or any kind of in need that they really want to have some kind of support from the community. We are really hunting for them to reach our resources in Hong Kong. And by then, once we have connected them, then we hope that we can connect them to the local mainstream services in Hong Kong. So that services will be including a variety of services that we have in Hong Kong, no matter it's quite a functional or quite developmental or any other services that we try to work with them and support them for the services or any kind of resources that we can really to enhance their health being or their mental wellness. So that is what we are doing at this moment.
Okay, thank you.
Thank you.
Thank you. Anju, please.
Thank you, Paul. Hi, everyone. My name is Anju Ghising. I am Nepalese social worker. For me, I'm currently working with Baptist Kwan Social Service, and prior to that, I had 4 years of experience in mental health, 3 years in ICCMW, and 1 year in project-based mental health service. And currently, I'm back to ICCMW. And about me, very excited and thankful to the organizer. And also thank you to the supervisor for letting me, part of this conference. Thank you.
Thank you, Anju.
So I'm Anthony. I'm the head of organization and talent development in Health in Action. So Health in Action basically focus on promoting the well-being of ethnic minorities and also some low-income families in Hong Kong. So in our points of view, apart from mental health, basically ethnic minorities are suffering very high cardiovascular disease risk in physical health too. So basically, in our sense, it's like a health equity problem in Hong Kong in terms of ethnic minority health. So our work is trying to, in a quite preventive approach, to promote accessibility to healthy lifestyle for ethnic minority groups and also increase their health literacy. And basically, we try to engage our youth and to know more about health resources and try to gain some skills how to manage their physical and mental health. And then through some multicultural youth, they can try to manage their families or even the community health. Yes.
Okay, thank you, Anthony. Okay, so may I kick off the discussion with Shilpa first. We learned from Eric that non-Chinese people in Hong Kong, they actually don't really go to the public health system. So is that what you see from your clients? And if that's the case, so why would they approach Zubin, and what are the main issues that they face in terms of their mental health?
Yes, we have around 213 clients over the 2 years, 2021 and 2022. And I would say majority of them, they did not approach public health system before. How did they come to us is mainly through our Call Mira helpline. So they get references from their friends, families, or sometimes community organizations to call the Call Mira helpline. And also I can say equal number of clients we got from our outreach work. At the Zubin Foundation, we have outreach work, not only for mental health, but also for the other projects. So we do attend a lot of health talks on mental health, conduct various events for the checkup, the mental well-being checkup. And we have other service users from the other projects of the Zubin Foundation, where we give them this DAS questionnaire, well-being questionnaire, and those who are scoring moderate and high on DAS questionnaire, we do follow up very actively with them. At that is the time when we introduce them what the counseling is, what is our service. And many of our clients, we got it through when they know about our service and they know that they have higher scores, they decided to seek counseling. Saying that, few of our clients did approach, they were already receiving medication. As Yinam said before, that they were actually not included in the randomized control trial because they were already, that was the exclusion criteria. But we did still provided counseling with them. And for them, they were receiving medication from the public hospital, but they still decided to seek counseling because they thought the issues, though the symptoms were less, but the issues were not covered when they were receiving the medication. And few of our clients, they did report that they actually approached the general practitioners, GOPC, mainly presented with the somatic symptoms. And some of them were referred to sometimes psychiatric nursing or some social workers for counseling. But there also they felt that the cultural issues because of which they actually had the symptoms were not addressed. So that's why they decided to seek help from us.
Okay, thank you.
As regards to the main issues that we found, the topmost was family conflicts. So it might be between parent and children. One of the major part was discrepancy in the value system. for the traditional parents versus the contemporary children. Forced marriage or arranged marriages was one of the main issues as well. There were marital conflicts, there were conflicts with the extended families. Second major issue was trauma, either physical, sexual trauma or sexual abuse, or it can be because of trauma of domestic violence. And third most common issue was also stress because of handling a big family. So that was those were the main issues which were more culturally related, and they seek help from us.
Okay, thank you.
Thank you.
Oh, I have forgotten to say that we'll leave 15 minutes for Q&A at the end. So while you're listening, please pencil down your questions for our speakers. We'll have the discussion later. Okay, Faye, you said you used the word hunting.
Yeah,
So,
our core business.
so please let us know how difficult it is to actually find those people that they need the help. What are the barriers and the challenges that they face?
Yes, I think hunting is because our team nature, this is our core business, which is really requested by our social work department, that we hope that we can connect them to our community resources. So how open they are in when my colleagues reach them. So I think that they really locate some difficulties. So first of all, we would like to start from 2 points. That when they have any problems or when they find something that they cannot deal with or want someone to be inquired, we have to notify that who they will look for, either their friends or our professions. That mean professions mean either counselor, social work, or any kinds of institutions to support. And then the other one is that whether they are willing to talk to us. Okay, and the first one that is very interesting that we find one experience that we have a focus group sharing with our EM clients. This is very interesting when we ask them that when you have some kind of difficulties and we have if you have any kind of unhappiness or feel stress, how you deal with, or would you really look for counselor? So they answer us quickly. The answer is no. So they won't look for counselor. But how they deal with their difficulties then, they just tell us that I'm not ready to to connect with the professions because that I'm afraid of my problems will be disclosed to their community. And that they tell us that I don't want to tell because if I tell anyone, that means that I am having a problem. So that is something like, it's a stigmatized that they have their difficulties in encountering. And the other one is that they lack of the resources, that they don't know whether in Hong Kong we have some kind of support for them to simply ask if they find something they want to inquire. In fact, if the social workers, for us, that we are not only dealing with those who are having problem, but we are dealing with if they want to inquire something, in fact, we can answer them, right? So that is very important, that how we can really let them know we are here for support, no matter how difficult they are and how severe their problem is. So we hope that we can really walk along with them. And once that if we have a rapport with them, they will be easily to disclose their issue and their problem. So I think that take times. We need to take times to really have the rapport with them and build up the trust between the worker and the client. And at the meantime, that when we ask them how they can be, get some kind of release of their stress or have some happiness or deal with their problem, they will just share that if we organize a lot of activities, then that means that they have no matter family activities or any kind of gathering for the ladies. So that is a mode and a means for them to have a little bit time for relax and have some times of sharing of their difficulties when they encounter. So this is some kind that the step that we need to go through different phases. For the first phase, maybe we need to help them to join us to get them ready to open themselves. By then later on that we hope that we can explore more, or they feel confidence, they feel safe there to share their problems with us. So that is what we experience. So that is how they open depends on, are we here with them, or they really know about our resources and next step that whether they are willing to talk to us openly. So that is that I think that is some barriers that we hope that we can take a look how we can introduce our service to them neutrally at the first hand. So that is really important. So we hunt for them at the beginning time, simply start where they are. Yeah, and then we can just go through in depth what they need, really.
Yeah. Well, this is a really important message. I hope the funders or the people who would understand how difficult it is to engage them at the beginning, and it takes time to develop that kind of relationship, working relationship.
Thank you. So to those of you who do not know what is ICCMW, ICCMW stands for Integrated Community Center for Mental Wellness. And in Hong Kong, we have 24 centers. These are, we call it as mainstream services. And these are district-based, and they provide one-stop services. So if a client goes in, and it's not just their mental health will be taken care, but also tangible needs such as CSSA, housing needs, public housing needs, employment, etc. So for me, I was part of ICCMW since February 2019. So I think I happen to be the first ethically diverse social worker who was hired by ICCMW. To be honest, if you ask me how was my experience was like, bit challenging, and it still is challenging. If you ask me about my feelings, very angry, very frustrated, right? I guess I don't really need to explain why, but generally speaking, I think if you ask me about do non-Chinese, do they go there? Perhaps the usage rate is really low. So for example, from the statistics from 2015 to 2017, we have 15% of ethnic minorities living in Yau Chi Mong, but the usage rate was lower than 1%. So that really gives us a brief idea about the ethnic minorities usage rate, access to ICCMW. And so what happened? Why is this happening? Why people don't go? So I think definitely people don't know that there is ICCMW, first of all. ICCMW, again, is it's mainstream, so they do not really have pressure to serve ethnic minorities. They don't have any statistics to meet. So, for statistics for funding service agreement, they can usually get it from the local Hong Kong locals. So they don't really have pressure. That's true. However, we also need to understand, okay, we all are trying, we all are working on this. The other interesting thing that I observed was I received few cases on the ICCMW, and the few cases, when I asked them, since when you've been taking medication, and they told me, 2 years ago, 3 years ago. So did your psychiatrist, doctor, did he or she ever refer you to ICCMW or for any kind of psychological services in the hospital? No. What happened? So the question is, did they not tell them about ICCMW, or the doctors thought that, even if I send this client to ICCMW, he or she is not going to receive any help because she can't speak English or Cantonese, or the client was like, sorry, I don't want counseling. So we really don't know what happened, because there are people who are receiving medication, and we know that medication alone is not enough. When it comes to mental health, there is personal medication, there is psychiatric medication, so both needs to go hand in hand. So I was the part of that. So my manager was like, hey, Anju, go out. People are not going to come to you, go out. So that's why I started to go out and do outreach. Started with some fitness program. Although I didn't get any cases from that fitness program, but what I received is that the ladies were happy. So I saw that as a platform for them to improve their mental health, to come together, because what they usually do is they drop off their kids to kindergarten, so they have this 9 to 10 a.m. break, sort of. So I said, okay, come on, let's do some exercise, let's just work out. And they were very happy. They were like, we have never seen, we see each other, but we never talk to each other. So that was, again, one of the positive experiences that I had. So we started off with 2 ladies and somehow ended up having 35. So, but after COVID, things got, again, that happened. So another positive experience is that when I was in ICCMW, people would know, there is a Nepalese social worker. Then I started receiving cases, some from psychiatric hospital, because they are very much linked. Hospitals would always refer to ICCMW whenever they whenever the client needs counseling service, but also from the community. They started to know, oh, there is one non-Chinese social worker. She can speak, South Asian languages. Okay, just refer the cases to her. So that was my whole experience. And I think with another project base that was part of from Mental Health Initiative Funding Scheme, we don't really get cases from hospitals, but we would get cases from friends. The friends would refer the cases, and we found that youth, the youth that I was serving, they were very motivated. They want counseling, and the interesting thing is they want therapy. And somehow, these two terms are interchangeable. But I think maybe because of Hollywood and, like therapy, quite fancy, I don't know. So they just like the term therapy, and I had to explain to them, it's basically same, but if you really want to, maybe they thought of BetterHelp, they would pay few hundred hours. So I had to, explain it to them. So, those are some of my experiences. Thank you.
Okay, good. So Kwan is fortunate to have you as one of the workers. Okay, so Health in Action. We talk about mental health, but Health in Action actually serve low-income families with health and mental health issues. Anthony, can you tell us a little bit more about the differences that you see from non-Chinese families and Chinese families?
Yeah, basically they have a lot of barriers in accessing approaching some of the healthy facilities. Just for example, a sports ground or even like wet market to buy healthy food or just do some sports. We have one woman like her BMI was like quite high, and then some cardiovascular disease risk. Then we show them, you should do some exercise, and we show her the community. And when we pass by the Kwai Fong sports ground, and then she just realized, oh, this such a big sports ground, we can get into that easily. We just need to go into it and then just do some jogging or even walking. She doesn't know about it before. So basically, I think when we, as a worker, when we approach low-income families, we can suggest some very like advice or something. Basically, there's some parts is based on our experience also. We can approach that in our community, and then we try to advise them to do the same thing. But for ethnic minority client, we have to take into account that how they can do it or how they can achieve it. For example, like most of the sports ground or sports center are really transparent in terms of like a table tennis room or something, right? So this is not favor for Muslim women to do exercise inside because it's too transparent, and then they will not willing to go into that. So for our gym room, basically we have curtain for them to do exercise or even gym, and then even Muslim women will come here every day, or maybe some twice or 3 times in the morning to do some exercise. So secondly, I think for us, we have to think about what's the strength of ethnic minority communities too. Because, for example, family bonding, or even like just like Andrew said about like youth, actually they are very motivated to promote some of the health message, and also try to influence their families too. But when we neglect all those like their strength, we just provide individual advice. Actually, it's very hard to motivate them to do something. But if we do it as a group, or even like, we can take care of your children, and then your parents can be doing exercise at the other room, then will be very helpful for ethnic minority families to achieve their healthy lifestyle.
Okay, thank you, Anthony. Okay, so let me come back to Shilpa. We talk about the effectiveness of the LCT, and then we learned it from Professor Danish that CBT it's egocentric, and the I it's the I, right? So how do your staff and yourself adapt or moderate the ego-centric CBT into helping non-Chinese women in Hong Kong?
Yes, I mean, we cannot, though our protocol is based on the CBT, we do have to modify some of the strategies according to the clients that we are serving. One of the things definitely helps is the language and the cultural awareness, because all our counselors are from the ethnic minority background. So when the clients are, they see us that, okay, you can speak my language. And though, like, I'm from India, but I may not be aware each and everything about all the practices, let's say in Nepal or in Pakistan, or we also have Filipino clients. But because I'm aware about the South Asian or Southeast Asian culture in general, they are more ready to open up and share their experiences. Regarding the treatment protocol, we do need some modifications. So based on the client's need, we also need some cultural modifications. Let's say at times we have more mindfulness strategies for those clients who have history of trauma, who they present with trauma. We did use narrative exposure therapy or similar kind of strategies to help them to process trauma. Also some modifications, especially for the clients with low literacy or less cognitive ability. We did use more behavioral strategies, simple language, use of diagrams, use of sometimes audio, video. So we may not be exactly use all the terms which are used in the original CBT, but we did modify according to their needs and according to, like, using in the language that they can understand. Because if we use the original language, they may not be able to even understand what we are saying, and the counseling will not be effective at all. So these modifications were definitely very much necessary as per the client need. Another thing, actually, what helped is also flexibility in terms of mode of counseling. I have also heard it from we all know that the compliance can be a major issue when it comes to the ethnic minority population, but we were able to provide face-to-face or online based on the client's needs. So we have many, like 85% of our clients are female, and they have the responsibility at home. So they have young children, which they cannot keep anywhere. I mean, generally they don't send them to the child care center, right? So we have online counseling which help with the compliance towards the treatment. So there's flexibility in terms of mode of counseling, flexibility in terms of treatment protocol, language and cultural sensitivity did help for the clients to open up and share. Like mentioned earlier, we have regular supervisions almost every week for all the counselors. So we did discuss about what can be the best possible strategy for this particular client, because though they are all South Asians or Southeast Asians, but they still have different presentations. So we did discuss that. And I would also, for the effectiveness that you were saying, I would say the equal credit also goes to the clients, because for most of these clients, they may not be even may not have experienced counseling before at all. Maybe it's the first time in their life that they are talking to someone to seek help, but they were ready to open up, ready to share their struggles, and most importantly, ready to apply those newly learned strategies in their life. I have seen they may not be, like CBT requires a lot of homework. We have found in our sessions that our clients may not be very good in their homework. I mean, some of them they do, but some of them may not. But then we don't stop it there, but then we give them more behavioral strategies. So rather than the cognitive, paper-based homework. So they were ready to implement those strategies in their daily life, whether they do homework or not, but implementation of those strategies in the daily life definitely helped us in effectiveness of the counseling.
Sounds like your staff have been helping them to comply with the strategies. That's good. Okay, so let me shift the discussion a little bit though. We talk about a equitable social service or health service systems, and we also learn about the barriers and the challenges. So if we are to help more non-Chinese individuals in Hong Kong, as we know that the population is increasing, so do you have any recommendations, or what are the strategies that we can do to engage or hunt more individuals?
Yeah, we hope we can hunt more. But I think that this is really not, I think we do need to work together in different sectors among all of us. I think the most important how we can create an environment that we can really hunt for more. But the point is that after we hunt for them hundreds, thousands, then what will be the next step for them, right? So we are going to refer them to use, or really they can really have the support from the community. So where the second question is whether in our existing institutions, centers, or any service sectors, that do we provide some kind of support to the non-Chinese people in terms of, for example, just we just discussed about that, whether the language that we can provide for them. So for example, in a CNY center or in IFSC, from the entrance of their notice board, do we find any languages in their language, or at least in English, that we welcome them to the service sectors? So at least at the entrance, that if we welcome them in their languages, then I think that they know that center, they are providing this kind of support to them. So I think that this is, we do need to work on more, for example, from our outreaching team, we hope that we can work more with the mainstream service sector when we have our clients refer to them. We hope that piece by piece, step by step, that we hope that the center can have this kind of at least a language support. Of course, if they have the non-Chinese staff, that will be perfect, because it's easy to engage with them and easy to provide the service with them with their languages. I think that is language and information is in their languages is very important to provide a really open environment for them. And second part is that how we can, among all the institutions or centers, we can really interface together and work together. Okay, for example, how we work with ICCMW or how we work with HIA. So is there any interfacing that we can work together hand by hand, that, or step by step we can work on to provide, because from our team, we cannot do anything by all ourselves. So we need to co-work together with different kind of resources, so that we hope that we can cater for different needs, and or of course maybe they have any problems, then they can we can identify them and really fall into our mainstream service. So I think that is really important that see we can through this platform, let's see that we can work on together, no matter for not only providing service for Chinese, but I think that from the statistic we find from Shalini that a lot of, the population is increasing of the EM. So how we can maybe in the future Hong Kong becomes have half of the population are in EMs or non-Chinese, right? So we hope that how we can work together through different institutions and partners. That I think that's really important. Of course, we hope that we can have the resources from either government or from, for example, from foundations. Okay, so let's say that we have some resources, some pilot or some support initially. By then, we can really share with maybe the government for any kind of further support. So I think that it will be my observations and recommendations. Yeah.
Sure. Thank you, Faye. Anju or Anthony, would you like to add something? To like what can we do better to improve the mental health of non-Chinese in Hong Kong?
Okay, I would like to start off with one thing. I think in Hong Kong, we often have heard about cultural sensitivity, and recently we started hearing about cultural competency. And now I think there is one thing that I would like to add is cultural humility, which is to self-critique yourself, self-evaluate. Do I have any biases? Something that Dr. Fulgram mentioned earlier about racism, unconscious biases. So do we have these in ourselves? Do we have these in our policies? So once we have that mindset or that mind, probably we can do more. So I think the suggestion is to really have research mind advocacy mind for ethnic minorities. I think these are really the guiding principles that can really help us to understand them better. And another thing would be, in terms of suggestions, I think maybe some of you have also heard about trauma-informed architecture. So similarly for ethnic minorities, we can also think of culturally appropriate architecture so that they feel welcomed. And of course, I think we often talk about signages, so these are pretty basics. But other than that, I think giving ethnic minorities voices, letting them know that they have power. And also another thing is, we talked about CBT. The thing is, for CBT, I think only maybe few of us have done this course through university, but when we want to access this sort of courses in the community, it's not available for the professionals to learn. So I think that's something I would like to highlight, perhaps how, other than university, hey, if any non-Chinese professionals, counselors, social workers want to, upgrade their knowledge so that we can have best practice, evidence-based practice in our setting, then probably we need trainings. And for that, we only have online trainings, but we need, I think, English language trainings like CBT, ACT, emotion-focused therapy. So all these trainings, I think we can also think about having these trainings to be provided in English language.
Okay, thank you, Anju. Anthony.
I still believe in the power of the community. So I think basically we need some cultural media that is promoting mental health well-being, because for example, like there's a lot of media like Shall We Talk. Basically they want find some celebrities to talk about mental health, right? But those cases or the demonstrating cases are all in local Chinese context. But what if there's like a media finding youth or maybe some multicultural celebrities to talk about some cases in terms of ethnic minority context, like their education stress, their work stress, their like even such like family issues and like arranged marriage, those stress, those basically it will be very tailor-made to promote mental health and how they can communicate or understand each one's values. Those are very critical in preventing mental health disease. So I think still we have to engage with youth and some cultural or media powers.
Right, thank you. So that's why we're lucky we have two wonderful service recipients sharing their first-hand experience with us this morning.